Let's talk about perception or reality. Has the problem of cancer grown, or are there fewer cases of cancer than, say, 10, 20 years ago?
Excellent question, and one that I probably get asked several times a week by patients and friends and acquaintances. And part of it is a perception that there is more cancer today, but the reality is that with our means of early detection, and patients are more aware, and so when they develop a symptom, they're more apt to come in. A doctor say, you know, we've got a problem, let's check it out. So yes, the numbers are increasing in terms of the detection rate.
You know, it seems like 10, 15 years ago, we all knew someone whose lives had been touched by cancer. Now it seems like if cancer hasn't touched your life, you're almost the exception, not the case. That it seems like cancer, various forms of cancer, affect so many different people in so many different ways, and yet there isn't really a magic bullet that's been invented that can cure it. Are you frustrated by that?
Very much so, and one of my dreams is that I will work myself out of a job, that there will be no cancer patients to come in, and one day I will come into my office and my receptionist will say, you know, Mary, there's nobody that has cancer to come and see you. It's my dream.
So talk about preventative measures that we can take, and let's talk specifically about breast cancer. I mean, it seems like it's been so well publicized, and most women know about the danger, yet most women take chances with their diets and with other things. At the top of your list, in terms of doing whatever you can to prevent it, what's at the top?
Diet. The issue of genetics, we used to think was a huge component, but now we know that's only maybe 5, possibly 10% of the reasons that patients will develop breast cancer. And there are some things that we can't control. For instance, we can't repick our parents, and there are some things that just happen to us in life that really are out of our control. But there are some things that we are learning that make a big difference.
What do you mean, for example?
You talked about some of the preventive measures. Well, diet is, to me, a really big issue. Because when you think about that, we can control what we put in our mouths every day, or maybe more importantly, what we don't put in our mouths.
Right.
I happen to be a vegan, which a lot of people think, oh my goodness, you know, what a weirdo. But if you look at the studies today that are looking at the relationship between dietary measures and breast cancer and many types of cancer, and even to other health issues, there's big research that will support healthy eating. Now, healthy eating is very simple. Lots of fruits and vegetables, avoiding animal products and dairy products. And when people first hear that, they go, oh my goodness, I could never do that. But once you start understanding the potential health benefits of that, and while it's no guarantee, it certainly can help you have a more healthy immune system, so that if you do contract cancer or some other serious health problem, you've got that resource behind you to help you fight it. And nobody's, quote, immune to cancer. And some of us thinking, you know, that we've done our best to control, you know, dietary measures. We've tried to do a regular exercise program. We've tried to keep stress down. But there are factors that will come into play that we don't really understand, and like we were talking about, we don't really have control over. But that being said, if we then approach it with the things that we can control, you know, our lifestyle, our dietary habits, something as simple as sunlight. We're finding out as a little specific that's really a big thing is vitamin D. There's a big correlation between breast cancer and vitamin D deficiency, or a low level of it. And one of the issues that we've long looked at is, why do people in the more northern climates have more breast cancer?
Right.
Not the total answer, but think about it. We don't have much sun exposure. Right. And we're doing a little bit of a backlash to our previous sunny days where we all had to be blonde and tan, and we got our melanomas and our wrinkled skin and our basal cell carcinomas. And as a backlash to that, we've now slathered sunscreen over ourselves. We're inside all the time.
Protecting ourselves too much.
Exactly. And so it's gone backwards. backwards. So now vitamin D, which sounds like such a simple little thing, can be a huge help.
Right.
So while
Right.
we know that, yes, if you could expose yourself to 20 minutes of sunlight over 40% of your body every day, that would be enough vitamin D to assimilate, bring those levels up to a normal level.
All right, can I ask you about a cause-effect relationship between something you touched on, lowering your immune system and making yourself more vulnerable to getting cancer?
Yes.
Is there a cause-effect?
Absolutely. And while there are some people that just seem to inherently have this really strong immune system, their parents may have given them some just really great genes, or maybe the way they have cared for themselves, so they're inherently very strong with their immune system. And on the flip side, some people just seem to come through life with a very weakened immune system. So if we could do things that would enhance the strength of our immune system, and those things we were talking about, making sure we're eating correctly, getting enough water, exercise, decreasing our stress, changing things that we can.
Because isn't the immune system a lot like blood pressure? You really can't tell when it's low or high.
Yes.
Can you?
Exactly. And so some people will come and say, I just feel great. And so does that translate
Right.
to checking all those, little T cells and see if they're really doing their
Right.
job? And it's not like we can put that in a little bottle and say, Les's immune system is just great today. Now, when we get a cold or we're feeling run down, we might say, my immune system really isn't at top functioning capacity today.
Right.
And so you're right, it's one of those
Right.
kind of things that you really can't capture or necessarily measure to know how you're actually doing.
And early detection is key
Absolutely.
for all forms of cancer. In terms of breast cancer, though, mammograms are still probably...
Yes, considered gold standard.
All right, but what about self-exams? Because there's been a little controversy about self-exams. I'm confused.
And you are in good company. Many people are confused about that issue of breast self-exam because we have for a very long time shared with patients, help us out as your physicians and caregivers to know what is new or different. And I'm actually a strong proponent of breast self-exam, not to put the onus on the patient that you must diagnose what's going on. Help me by telling me what's new or different to you. Become acquainted with what your own body is doing or not doing. Is your breast tissue changing? And if it is, you don't have to diagnose it. Don't put that pressure on yourself as a patient that, I have to know the answer to this. No. If there's something different or that you have a concern or just maybe intuitively doesn't seem right, go in and have someone help you figure that out.
What about someone who fears that if they come in and talk to you about a subtle change, it might be embarrassing because it's nothing?
It's so interesting. Just last patient I saw yesterday, very issue. She came to me, she said, I'm almost embarrassed to be coming and seeing you. Says, I know everybody thinks my mammogram is fine and nobody's found any problems on my breast exam, but I'm worried about it. And I said, that's a great reason to come in. So we looked at all her mammograms, we talked, and she left feeling good about herself. And
Right.
so, and I told her, I said, I would much rather see someone like you coming in
Sure.
early and we say, you know what, this looks great, than someone coming in 10, 15 years of ignoring something and there's a very far advanced breast cancer. That breaks my heart because then we don't have the opportunity to help
Right.
her.
So what kind of advice, with Race for the Cure coming up and so many different causes, what kind of advice would you give to listeners who worry about it but don't necessarily have the problem yet?
Worry doesn't help anything, obviously. And so taking action, and that action can be as simple as taking control of what you put in your mouth, saving a little time to exercise, think good thoughts, surround yourself with people who support you and are positive, get yourself out in the sunshine a little bit, educate yourself, know if something's different, and even if you feel a little silly, go and see somebody about it.
Sure.
The worst thing they could do is laugh at you, and big deal if they
Right.
do.
Right.
You found out that everything's okay.
And that sure beats worrying.
Absolutely. That doesn't help anyone.
Dr. Mary Barnhart, thank you very much.
Thank you, Les.